San Juan Regional Medical Center is your community hospital, committed to making life better for the communities we are privileged to serve. In fact, better is our mission, improving lives through personalized health and care. What matters most to our patients matters most to us, offering a comprehensive range of inpatient, outpatient, and emergency care services so you can get the quality care you need right here at home. San Juan Regional Medical Center, celebrating life better here since 1910. KSJE is supported by the Farmington Civic Center, bringing a full slate of entertainment to Farmington and San Juan County. Country music stars Lone Star, Thursday, June 9th at 7:30 p.m. The Farmington Civic Center, 200 West Arrington in downtown Farmington. Find out more online at fmtn.org/shows or at 505-599-1148. 11 minutes past 8 o'clock. It is Tuesday morning, the 7th day of June, 2022. Good morning, everyone. I'm Scott Michlin. Thanks for tuning in to KSJE, 90.9 FM, of course, over the air here in San Juan County, New Mexico. Everywhere else, you can tune in, of course, at KSJE.com. And Durango fans, don't worry, we are getting ready to get back on the air at 103.3 FM in the Durango area. That is coming soon, so we hope you'll stay tuned for that. And we thank you for your patience. Welcome also to our viewers who are watching this visual radio program. The video is streaming out live this morning to the KSJE Facebook page, our YouTube channel, and our Twitter account. So we're glad that you are with us watching there as well, everyone, because coming up, it is our monthly commitment to C.H.I.C, the Community Health Improvement Council of San Juan County. We'll be learning more about what C.H.I.C does and is doing right now in the community. So stay tuned for that conversation, which begins in the next few moments right here on KSJE this morning. Later on this hour, then we'll check in with Amber Francisco over at the Farmington Regional Animal Shelter. She'll be telling us about some of the animals available for adoption this week, including Tadpole. That's the dog you see on the screen right there who is ready for his home. We'll learn more about him and some of the other animals coming up later on this hour, 8:50 a.m. on KSJE. Next hour, it's Roving with the Arts, our classical music program, and Mick Hess will tell us more about that, and he's playing music from Brahms. That's coming up today after the news at 9:06 on KSJE. And don't forget, you can also connect with us on our Instagram page, in addition to Facebook and YouTube and Twitter. And if you're a podcast person, we invite you to subscribe for free to KSJE Podcasts. Maybe discover a new program that you haven't heard before. Check us out on all the places where you download podcasts, like iHeartRadio and Spotify and iTunes and Google Podcasts and Pandora and much, much more. Check us out and discover something new. Outside our studios here at San Juan College, it is a partly sunny morning so far, 66 degrees outside, and we are expecting a mostly sunny day today and hot. Look at that. The heat is here all week, in fact. 92 for a high this afternoon, clear overnight with a low of 55. It'll be sunny again tomorrow with a high of 94 on Wednesday and Thursday, with overnight lows in the mid to upper 50s, 96 with sunshine on Friday and Saturday. Very hot in the forecast, 58 and 60 degrees overnight, and then again mostly sunny and 94 on Sunday. Winds pick up maybe on Monday with a high of 93 degrees. Well, let me introduce my guest who is here with me this morning, back to talk about C.H.I.C, the Community Health Improvement Council. Amanda Evans is here from C.H.I.C. Good morning and welcome back to KSJE. Good to have you here.
Good morning. It's nice to be here.
You bet. Great to see you again. And, of course, as I mentioned, we have been working with C.H.I.C, for a while now with a monthly spot, right? Talking about what C.H.I.C does and just giving some exposure to the community and being able to talk a little bit about all the different things that C.H.I.C does every month.
Yeah, I think we've been doing this at least 8 or 9 years. It's been a while.
It's been a while, I know. And it's always something new, always something different,
Yes.
It seems to me. And that's been great. And so this month, we'll talk a bit about what C.H.I.C does. And as we mentioned, it's the Community Health Improvement Council. So it's made up of a lot of other kind of entities, and you're always, I think, adding and subtracting and inviting new people to join you and all these different things as the needs of the community kind of grow and morph and change and evolve, right?
Right. We've got a lot of really great organizations. We've got community members that just participate. Really, What CHIC is addressing health, but on a much broader scale than some people think about. So a lot of people think medical, dental, but we have people from the schools, we have transportation, senior issues, veterans issues. We want to address it on a much bigger scale than just whether people can see the doctor, although that is a part of it too.
Right. You do deal with just regular health issues,
Yes.
right? But also this broader topic of health, like, as you mentioned, education, transportation, and housing, and all those other different things. And so coming out of COVID, hopefully,
Right.
and that's health.
Yes.
But certainly it uncovered so much more, I think, too, right? That probably is something that CHIC is now looking into as well, right?
Yes, we've actually received some funding through a grant through the state and through some different organizations coming down from the CDC to really address health equity issues that have come up through COVID. It's kind of a rebuilding look at health and how some of those disparities, some of those issues that we have in the community really contributed to some of the negative COVID outcomes.
And health disparities, help us understand what that term means.
So it means that it can be geographical, it can be economic, it can mean racial issues, it can mean all these different parts of how a community functions play into whether people have equal access. So health equity is really making sure not that everybody has the same outcomes necessarily, because people need different things, but that they all have the same access and that they have what they need to get the best help. So one of the big issues we have even before COVID is food deserts here. Farmington, if you live right in Farmington, we have 2 Walmarts, we have several different 2 Safeways, Smiths. But if you're outside of Farmington, there's less options. So a food desert is where there's a place where it's hard to get fresh fruits and vegetables. And we have quite a few places in San Juan County that are like that.
Right. And like that because they can't then get to a place like the bigger city where that's not such an issue, right? And they have to drive tens of miles to get there, right? Further.
Well, and some people might not have transportation.
Correct.
They might not have great working transportation. Right now gas prices are a huge issue with whether people can get the food they need.
So driving 30 miles into town to go to grocery store maybe isn't an option as much anymore as it used to be because of high gas prices.
Yeah, so we're trying to look at all those different issues and how they impact, because we know healthy foods make a huge impact on your health. We know transportation, whether you can get to a doctor or not. And there are options, but people don't always know that. We have a lot of our system that has free transportation if you qualify to medical appointments, but how do you access? You sometimes have to know in advance, you have to schedule it out, you have to make sure you get the right company, all these different things, and that's hard for some people to find that information. It's not readily out there as much.
Right, and that's the whole idea of this disparity, I guess, right? That even though we have health care available, because people will, I think, point to like the Affordable Care Act and things like that, which did a great job of providing, or kind of leveling the playing field, if you will, to just say, if you're sick, we want to make sure that you can come to these different facilities and get care. Right. But then how do you get there? And how do you do that? And how do you stay healthy? And how do you maybe maintain your health or prevent something more serious from developing, and those regular checkups and things along that line? And these are some of the other things that CHIC talks about.
Yes, all of these are different issues that play into whether you have a healthy community. And you hear, well, it's a personal decision if someone's healthy or not. Well, it is, but it's also a decision that can impact our community as a whole. And so the healthier we have parents, the healthier kids we have, there's this whole dynamic that we have to really look at as a community. And that's why the community should really want to be a part of something like CHIC. There's different groups out there that address different aspects. We have a great mental health task force. We have the CHIC that looks at this broader. There's different groups that people can get involved in. And that's really important to the community to get your voice out there.
Right. And going back to what you mentioned about food deserts, and I think the other issue has been maybe looking at convenience stores, which they are convenient. It's in their name,
right.
But they're not a grocery store. Right. I think some try to maybe stock some fruits and vegetables, but again, there's usually not a lot in there, certainly not compared to a grocery store. But sometimes that's the nearest place for a lot of folks who live outside of the metro areas, if you will, where they can go for snacks or food or milk and things like that. And that's part of what we're talking about, right?
Right. And, if you have a hard time getting there, then it makes it inconvenient. And if you're going to choose convenience sometimes because that's what you have time for, if you're working two jobs or if you're, got a family that you're trying to take care of also. And so, again, we have some great resources in the community. And that's why we do these positive wellness kind of type things every month on your show is, I know a couple months ago we had patients on here, I think, talking about how they've got the food truck that goes around now.
Patience Williams, not actually a medical patient.
Right. No,
yes.
Sorry.
That's okay.
Yes. Yeah. So there's a great group that have come together to address some of the food issues. And so they have, a mobile can take fresh fruits and vegetables to different places in the community. And then we've got the Harvest Center now. And so there's all this great work going on. And a lot of what C.H.I.C is really tasked with is getting that information out.
Right. Well, and the growers markets, of course, but again, they're in the larger communities.
Yes.
They are not in some of those other smaller communities, and so you still have to plan a trip and get there. Even though once you get there, there's a bunch of really good fresh fruits and vegetables available, but it's getting to those. But again, having this mobile maybe market that can get out to some of these smaller communities, which is kind of the goal, I think, is really admirable and great to see. So, and great to see how it's developed pretty quickly, I think, in the last couple of years. So that's really good. There is a committee too working on some of these things, right? This health equity committee that's doing some work as well?
Yes, that came out of the funding we received. And so we've got a whole nother year of funding. We've had about half a year this time. And so that group is going to be specifically really reaching out to the community over the next year and finding out what the issues are because, as someone who lives right in Farmington, I'm just a few blocks from Smith's. I don't have a problem getting to the grocery store most times. Affording it sometimes is different, but we want to really talk to all the different aspects. So geographically, we want to reach out to different areas in the San Juan County. We want to look at different populations, different economic situations, and see what are the issues that they're really facing, and what would be some solutions that they see would really help, because I think sometimes we have this top-down view where people come in and tell the community, well, this is what you need, and that might or might not be what's really helpful.
Right. And so that's another important thing. And so they're doing some work, and they're going to be doing some other things with the public this summer?
Yes. So our first kind of event with this group is we're going to be doing what we're calling a resource fair. It's going to be kind of like a health fair, but what we really want to do is get, one of the aspects with transportation is we have a lot of resources that are centralized here in Farmington. And so, they have to come here maybe to fill out applications for different organizations where they can get help. And so what we want to try to do is start taking it out more. And so a first step is doing this resource fair. And so we were going to have booths. We're going to do it at the Bloomfield Multicultural Center on June 30th from 10 to 2, and just have it a fun time. We're going to try to have some kids activities since it's summertime. We're going to have hopefully organizations there that people can get information, maybe set up appointments if they need to, things they might not be able to get into Farmington for. Got you. And so there'll be more information about that coming out very soon, right? Yes. With details. We're working. If you're an organization that wants to participate, you can check our Facebook page. We're going to be posting stuff. It's San Juan C.H.I.C. And you can find out all the details. We'll be posting flyers. We have an email, chick@sjcpartnership.org, that goes to me, and Althea Stevenson is our health equity coordinator. And so that we can both check that. And if you want to participate or want to be a part of the health equity committee or C.H.I.C overall, they can email that. Gotcha. And talk to me a bit about C.H.I.C. They meet monthly. You meet monthly, correct? Yes. And you were meeting kind of virtually during COVID. Is that still the case, or have you gotten back to face-to-face? No, we're still doing virtually. We've actually had a really big increase in people participating. Virtually, yeah. That tends to happen. Well, because it's easier. A lot of our organizations are very focused on helping the public. I mean, that's what social services is all about. So when you don't have to take out the time of your day to drive drive to a meeting, and then, the meetings end up taking a little longer in person than they do online. So we've had a really great group meeting, and it addresses some of the transportation issues from other areas of the county that might not be able to make meetings. So I don't know what we're still kind of looking at what that's going to look like, if we're going to try a hybrid, if we're going to go back to in person. But this month's meeting, we always meet the third Thursday of the month at 3. And so right now, for at least June, we're going to stay virtual.
Got you. But if folks are listening to us or watching this morning and they want to be a part of CHIC or find out what it's all about, maybe attend a meeting, that's okay?
Oh, yeah. We are totally open. There's no, right now, just because it is virtual, you have to email me to get the link, so we don't just put it out there. But again, they can email that C.H.I.C at sjcpartnership.org, and I will add you to the list, and you'll get the Zoom link. And it's just, people show up. We usually have 1 or 2 presentations on trying to let people know what resources are out there so they can share with their clients or customers or whoever they're serving, and then have some discussion around some of these issues and figure out, this month we're going to be talking some about, it'll be next week, so we'll be doing some planning around the resource fair and things like that.
Okay, very good. And of course, it doesn't necessarily have to be nonprofit organizations necessarily, correct, that make up CHIC. It can be for-profit providers and things like that, or other areas of the community, because as we mentioned, the term health is a really broad interpretation of community health, right?
Right. And yeah, we actually have some businesses that participate that aren't nonprofit. So the Farmington Chamber of Commerce had a health and wellness committee for their members. And we kind of figured out that we were all talking the same things at the meetings, and a lot of the same people. So we ended up actually kind of combining. So they attend the CHIC meetings now. And then they still, hopefully will get back to doing their health fair that they've done annually. It's kind of been on hold because of COVID, but so they still have that group, but it's meeting in conjunction with the CHIC now. So yeah, we still have some great business people that attend. We have, like I said, just community members that don't really have a job that is in the healthcare or one of these aspects of it, but they just care about the community and want to make a difference.
Very good. Well, it's a great organization. And my guest this morning, Amber Evans, is here. It is part of KSJE's monthly commitment to CHIC, the Community Health Improvement Council, here in San Juan County. It is something we've been doing, as we talked about, for, the last 8 or so years or so since we kind of agreed to do this, right?
Yeah, it's been, I need to look up the exact date when we started.
But cake next time you're here or something, maybe. I don't
it
know.
Feels like, yeah, I'll have to see. If it's been 10 years, maybe we will.
Some kind of party, right? Something going on.
Yep.
But it's great. And I think it's really important, again, to get the word out about the work that you all are doing each and every month, and getting out and talking about some of these issues that maybe folks aren't aware of. And I think the other part that I remember from some of our earlier conversations are, CHIC is working to maybe avoid duplicating services, and maybe find things like the Health and Wellness Committee with the Chamber, that when they join the larger CHIC organization, it just kind of amplifies what work they were already doing in a more concerted effort.
Right, and that's one of the things we're trying to do with this health equity committee. Is there's lots going on in the community around health equity, so we do not want to, be duplicating or doing the same things another organization is. So we just want to get out there and find out what's going on. How can we help? How can we support them, and make what they're doing even more available to the community.
Right. And get the word out to the community, too. I guess that's always kind of the marketing question, right? Is how do you inform people? As much as I wish everybody was watching us right now and listening to us this morning, I know that's not the case. And so how do you reach those folks to learn about these opportunities and these things that are available to them, to kind of make things more equitable?
Well, and that's one of the reasons we've been so lucky to be able to hire a coordinator, because I'm the coordinator for the overall CHIC, so I've been with the CHIC for about 14 years and am able to help run the meetings and keep things going behind the scenes. But we were able to hire Althea Stevenson as just the coordinator for the Health Equity Committee. And so a lot of her task will be getting out into the community and talking to people, because one of the great, we know one of the great things that's come from COVID is all this online virtual stuff. Again, we, have better meeting attendance, but there are people who don't have internet access who can't participate that way. We had to do our New Mexico community survey that the partnership helps with online completely. So we missed out on people who we normally might get in person and getting that. So we want to start getting back into the community and really talking to people on a one-on-one level.
Very good and important, right? Because you don't want to lose that voice of those folks maybe who don't maybe have the connections of a cell phone, or most everyone has a cell phone these days, but
Right.
even still some don't, or internet service or whatever, to be able to find out how they're dealing with what's been going on, whether it's COVID related or gas prices or what have you. Because I would imagine if I don't have internet service, it doesn't take much to upend my lifestyle or or my budget or any of those
Right.
other things too, which is really important. We don't forget about those folks.
Yeah, and some people just choose not to have those things. I mean, a lot of times even I think of it as like, well, they can't afford internet or they can't get it because of where they are in the county, but some people just don't want to be on that online presence. So
Sure.
we want to make sure they still have a voice in our community and make sure they're being heard, and make sure we know what the issues they are facing, or, even what resources they know about. Maybe there's something we've missed, and they have a great program out there that we haven't heard about. So we're always looking for presentations at the C.H.I.C, organizations to join, people to help out.
Very true, and that's important. And again, it goes throughout San Juan County, and C.H.I.C isn't unique to our communities, right? I mean, there are other C.H.I.Cs in other parts of our state and other areas and things like that, right?
Yeah, most of them
councils. Yeah.
Most of them don't. I laugh because most of them don't call themselves chicks.
I see.
We're unique, and I actually tried to do away with that when I started because I was a little like, people were like chick, but people know it by that, so I'm okay with it now. But yes, we have health councils in almost every other county in New Mexico, and we are actually unique. We're one of the only states that does a format like this, because most states have centralized public health offices in each of their counties, and not all of our counties do have a public health office. So they have these health councils are in place, and it's actually been, there's a House bill, and the number just lost me, but that legislates that health councils be the planning bodies for their communities. And so that's why we're trying to, get all this information and help people who are making decisions in the community maybe be able to give them some insight into what's going on.
Got you. Now, we have a local health department, right?
Yes.
In San Juan County.
Yes,
and so
we
you
do.
work with them and they work with you?
Yes, we actually have 2 Department of Health members on our health equity committee, and we've worked with them. That's part of what funds the Health Council is. We receive Department of Health funds each year. At least the last few, we used to have more, and then it was kind of cut, and then it's come back, and so it all just kind of depends on how the budgets in Santa Fe go. But we work with them. They are kind of our technical assistance people, helping us get data, helping us just reach out to the community in ways that we can't always. And so we have 2 really great people here that work closely with us.
That's great. And of course, we're a unique state, I think, too, when compared to maybe other states. We're a rural state, we're a poor state, and those, I guess, would affect health outcomes also, maybe more than even other factors, correct?
Oh, yeah. All of that plays an impact. The rural part goes into transportation, medical access. I know the hospital works a lot on keeping doctors here because, it's not a big city
Right.
always. So there's
Recruitment is a challenge,
yes.
right? Sure.
So
for
there's
all
all
those
these
things.
different aspects that go into having a rural state. Even meetings between different health councils, we do regional and statewide meetings so we can come together and address issues. That's a 3-hour drive for some of us to go to Albuquerque or all the way to Cruces. And so even just getting people together, that's, again, gone back to a really great outcome from COVID, is being able to do those virtual meetings more than we used to. But we still want to make those personal connections. So it's trying to find a balance with all of that.
Right. But that's where things are heading and where things are right now.
Yes.
And that's important. Just a couple of minutes remaining this morning, Amanda. So final message?
We'd really love to see more people at C.H.I.C itself. Again, it's virtual right now, but we're looking, at different ways to try to bring people who want to do it in person together too. So again, C.H.I.C, C.H.I.C, at sjcpartnership.org. You can email and ask to be added to the list, and you'll get the monthly emails. Again, the Resource Fair, June 30th, Bloomfield Multicultural Center, if you're an organization that wants to participate, or a person that wants to just show up and get some resources. It'll be a great event. You can watch our Facebook page for information.
Okay, very good. And it's a CHIC Facebook page, right?
Yes, it's San Juan CHIC.
There you go. Search for that, and you can see that. And of course, you'll be back, or someone from CHIC will be back next month, because we do this every month on KSJE, the first Tuesday of the month. That is when CHIC is on our schedule. And it's been a great partnership for these many years. But the CHIC meetings are the third Thursday of the month
at 3 p.m.
At 3 o'clock. All right. Yep. Very good.
Thank
Thanks for coming
you so
in.
much.
Good to see you.
Yes.
That's Amanda Evans from CHIC, the Community Health Improvement Council of San Juan County, my guest here on KSJE. KSJE is supported by the Alzheimer's Association, New Mexico Chapter, with a local office in Farmington, providing free services and resources to help those living with dementia and their families, including their 24/7 helpline, 1-800-272-3900. The Alzheimer's Association, New Mexico Chapter, 1-800-272-3900. KSJE and San Juan College present the Student Success Coaching Tip of the Week.
Hello, my name is C.H.I.C. I'm here with the San Juan College Student Achievement Center, bringing you coaching tips of the week for the radio. Week 1, organization is key. First and foremost, make sure you get a college planner. This can be a planner with a creative design, a plain notebook, a wall calendar, or even a small, dry erase calendar for your desk that changes each month. A wall calendar or desk calendar is best for double-checking appointments, events, and due dates, while a notebook planner of some sort will be best for planning on the go wherever you are. This planner will help keep you in check when you are in class or in a meeting with your advisor. If digital works better for you, you can sync your computer, phone, and tablet. Also, think about setting up an agenda on your mobile device. You can set up reminders for test dates, department events, study times, and assignment due dates.
The Student Success Coaching Tip of the Week, presented by KSJE and the Student Achievement Center at San Juan College.